Yeah. So like I said, I could really talk to you for hours and hours, Andrew, but we've only got a limited time for today, and I hope
Sure.
this is something that people have found helpful to give just a brief insight into what living with this condition for many years must have been like, and I can only imagine how difficult your life has been. But if I could ask you one last question, which is, as briefly as possible, if you could go back and speak to your younger self, what advice would you tell him? What would you kind of give him, as your bit of knowledge from now?
The one thing that I would say is, um, it's not going to be easy. There will be challenges, but it doesn't stop you from, wanting to be who you want to be. Give life your best shot. Always, go for the best, and don't feel like you're definitely limited. And also to be more open and share how you're feeling with people and tell people, educate people about the condition, because a lot of people, even in this day and age, still don't know about sickle cell disease that much. And we're talking about within London, and it being one the most common genetic condition in the UK. There's still a long way to go on the education point of view. So I would definitely say for younger people to speak up and to say how they're feeling and what they have.
Yeah. Andrew, thank you so much for your time today. And hopefully with more events like this and more ability to kind of get things out into a forum to patients and to clinicians who kind of will come into contact with people with this condition, it will try to get somewhere to getting that understanding out there slightly better. So I'm just going to sign off and say thank you again to Andrew, and just to kind of leave you with a quote from To Kill a Mockingbird. You never really understand a person until you can consider things from their point of view, until you can really climb inside their skin and walk around in it. And I think by sitting down and trying to understand what your patients are suffering, not just looking at the clinical problem, but trying to understand the impact of their disease on every aspect of their life, until you can really do that, you can't really imagine everything they're having to deal with. And I hope this patient engagement exercise kind of encourages you to do that as much as possible. So thank you, and thank you, Andrew, and I hope you enjoy the rest of the week.
Thanks very much.
Thanks. Bye.
Bye.